Okay, so
This
we'd be
is
interested to
Jeremy
see
from
if you can.
Mates in Mind, who's going to be talking to us about mental health in the workplace. I think you work a lot in the construction industry, if
We
I'm right.
do. Okay, thank you. So thank you very much for asking me to come along today. Yes, Mates in Mind, if I can just tell you a little bit about it. We were established as a registered charity in 2017. It was in response to the Farmer report, which showed that 2 construction workers every single day in the UK take their own life through suicide. And so we were initiated by the Health and Construction Leadership Group. And we were set up by them. We have a board of trustees working predominantly in the industry, and we focus on the charitable aspect, within construction. And we're very keen to start the conversation and support absolutely around the preventative measures to support tertiary. Now that will become evident as I talk. And we're a partner of the Health and Safety Executive Working Minds campaign. So what do we mean by mental health? Any one of us at any time has short-term distress, and that's very much responding to day-to-day pressures. And 1 in 6 employees in any week will have anxiety or depression, and 1 in 100 will have mental illness, which is generally being looked after by NHS services. And people will go up and down on that spectrum between good health and good mental health and poor mental health. And you can be anywhere depending on where those pressures are at any one time. So what pressures can impact us? And if we particularly think about construction, we think about the lifestyle of a construction worker, albeit they might be office-based or they might be boots on the ground, working away from home, very often in substandard conditions. We think about the SMEs and the sole traders who are reliant on the financial flows, the payments, the supplies, all the things that during the pandemic have actually become more heightened. So we think at home, at work, whether we've got financial concerns, loneliness, caring for family members, being away from the family. And then at work, we think about problems with colleagues, with line managers, particularly when we're thinking about mental health, the degree of control, how many construction workers are actually in control of what they do. And the constant change, construction is a very dynamic industry, very often driven by deadlines and budgets and a changing picture on a project or a site itself. The teams are having to really adapt in a predominantly male workforce to a lot of external influences, and it's how people respond to that we're seeing, as I say, those two suicides every single day. Stress graph, very much we talk to people about this. The left-hand side on top, performing well, we start to show signs of stress. So others might start to notice it in colleagues around you, where we're getting poor judgment, decision making, lack of sleep. And then we get to the final end, which is that burnout and that crisis end of mental health. And that's where we don't want people to get to. There are helplines, there are apps, there are all sorts of things at the tertiary end, mental health first aiders, for example. But we know we can do so much beforehand in that preventative space. I am literally, I think I'm going to be rebooting. I can't do anything about this. Mental health impact. So we see that there's a 2-decade high in suicides. We know the #1 killer of men. In construction, you're 3.7 times more likely to take your own life in construction. And when we compare that against work-related accidents, it far outweighs any site accidents. And this is, has been a real focus on health and safety, but why hasn't mental health been given the same level of priority? And what we see is that only 27% who died by suicide had actually been in contact with health services in the year before they died. So this is a hidden crisis that's there. People are not stepping forwards, but I will go on and tell you a little bit more about what we do. So people will generally give a different reason for their absence rather than actual mental health. They'll say they have musculoskeletal problems, they have back pain, knee pain, they've got an upset tummy, and there is still very much that stigma around absence around mental health. What we're seeing is that there is poor data capture around this because of those reasons that people are given to. We've then done some research specifically around the small, medium enterprises and self-employed construction workers. That was published last month. I think it's just worth flagging up that we've got two ends. We've got the end of the kind of the bigger industries that have the luxury of having a big HR department. They will have a health and safety team, and that's very often where those the first contact with us will come from. But then we also have the other end of the industry where these are people working in much smaller organizations. And we did some research around them, and these are particularly a hard to reach group. There are 1 million people working in this particular aspect of the industry. They are hard to reach. They are out doing the jobs, quoting for the work, trying to find the supplies. And what we do is we work down through the bigger organization's supply chain to try and reach them. So the average response was age 47, 83% of them were male, and they were working in micro firms. What we found, and this was done during sort of the latter end of the sort of the pandemic really, is a third of the respondents were reporting severe anxiety. This is much higher than has ever been found previously, and the finishing trades have got the highest severity. So we're talking about the painters, the decorators, the plasterers, the joiners, all people who generally, when you think about it, might be working by themselves on a site, and they work across different organizations and perhaps don't feel part of what's going on on the wider site. So this is of concern to us, which is why we really work through that prevention piece through the supply chain. And the top 5 causes that they were talking about was that the workload was too high, pressure at work, pressure at family, financial pressure, and talking with them about the business partners and their colleagues. And they won't, this is causing irritability. It's causing where relationships might become fractured. It's causing poor sleep pattern, which, as we know, there is a link there between that and accidents, and particularly on site. They're working generally with musculoskeletal injuries. They can't afford to take time off to address this, and therefore all of this becomes sort of a melting pot, if you like, for somebody who's putting up with a lot of personal background. The consequences of this, we're seeing people relying and starting to take non-prescription drugs. Combine this with sleep, combine this with accidents and someone's poor mental health, and this is again causing concern. The same number would consider self-harming and have a plan potentially in place that would speak to a GP. This is a real worry, because if they don't feel they can go and approach their GP, they are talking to people, they're talking to their friends or their family, but they're not necessarily talking to those who can help. So either the GPs or the line manager on site, because of this male stigma, because of the stigma of they'll be the first one out off the job, they won't be carried on through to the next project, their reliability, all these things that start going through somebody's head. And also that they are reporting drinking more alcohol than usual. So over 50% find it extremely difficult to talk about mental health. 2/3 still feel there is that stigma, and 40% would not dare, that was one of the categories, would not dare discuss mental health with a colleague. And as I said, most of them would speak to a close friend or family member, if at all. So when we think about it, we've got the tertiary measures. These are around the helplines, the apps. We always hear, oh, I've got 100 mental health first aid trainers in the workplace. And that is good, but that is good for someone who is perhaps at more of a crisis end. What we are more concerned about is that 71% have had no mental health training across the wider workforce. This is the prevention piece. This is where we can actually start making the difference, where you're looking at your colleagues around you, you're noticing the signs and symptoms of where somebody is starting to become more anxious, more stressed, out of character, withdrawn, etc. And then know how to start that conversation, know how to actually approach that subject, because very often people won't ask because they are scared of what the result might be. They don't know where to potentially signpost to, and more worryingly, they think they'd have to solve it, which is absolutely not the case. Just listen, and listen with compassion, and listen without judgment. And what we also see is that 56% of people have got a mental health policy in the organisation, but it doesn't actually mean anything. It doesn't come alive. So we're missing that section in the middle. So potential barriers to someone seeking help that we find in the construction industry: the acknowledgement themselves that they've actually are facing their own personal difficulties, the stigma, the perceived benefit. What's the point? What's the point of me talking to somebody about it or sharing? I can kind of manage it myself. Whether it's confidential, this again is a big aspect. Some organisations will have employee assistance programs, but they are worried that that will get back to their employer, and that will have a knock-on to their future career or future job prospects. And we found this. We have we're very fortunate to have a patron who works with us. Her husband took his own life, unfortunately, after 30 years working in the industry. And it all became very acute very, very quickly. And he was very worried once he'd spoken to a mental health first aider, once he had spoken to his HR department, that people would know and that he'd be out of a job. And that unfortunately led to him taking his own life. And whether it's the right time and the right place. So, you know, to actually match up somebody who's trained versus somebody who's in crisis, to find those two people together at the same place, same time, we have a responsibility for this to be everybody's concern, everybody's issue. There are the HSE standards. I won't, this presentation can be made available to you afterwards, but it is very much around that prevention piece and asking people, you know, what are you doing as an organisation around mental health? And as we say, we feel mental health is, everyone has a part to play in this. It doesn't matter about your job role. It doesn't matter where you are in the organisation. Everybody should be looking out for those around them. So Mates in Mind, we see this very much as a whole organisation approach. It's an organisation making that commitment to change, training the line managers to know how to engage and have that conversation, starting the conversation generally, providing that training and awareness, talking about mental health from the top. It's really important that the exec teams are bought into this. And you know, it really is from board to boots and upwards again. We also support mental health of the new entrants coming into the industry, the apprentices. These are the last, you know, the last couple of years where their education, for example, has been severely impacted by the pandemic. They're entering an industry that we know mental health has, you know, there is an issue, and we want to look after them. We want to prepare them. They are the line managers. They are the business owners of the future. And we very much feel that it needs to be targeted from both ends, those currently working in and the new entrants as well. So what will we be campaigning and recommending? We work very hard to make sure that mandatory mental health section is on the procurement frameworks. Frameworks generally are awarded based on cost, based on delivery, and there's always a question around health and safety, but there is no mandatory mental health section on there, and it should absolutely be seen as important. And what are organisations doing around mental health? There's no statutory funding to support this high concern industry. It's us working in construction as a charity, and Lighthouse operating their helpline and their tech service. We do feel that there should be that support for young people and new entrants. And suicide currently is not a reportable on-site situation. So therefore, we don't know actually other incidences that are occurring. We have over 600 UK related companies. We reached over 600,000 employees and their supply chains. And we're really proud of the work we do. I'm very happy to take any questions on that.